Welcome to Breathe California TV. My name is Terry Trumbull. I'm a volunteer with Breathe California of the Bay Area. We are going to escalate up in terms of the importance here by having Dr. Alan Goldsobel, who's a member of the board of directors of Breathe California, talk a little bit today. So a few weeks ago, Dr. Goldsobel came on and did a show that I probably should have done in 1992 when I started doing the show, which is an explanation of how your lungs work. Today we're going to talk about 10 to 15 different disorders that happen to lungs and what you can do to prevent them or mitigate them. So this is all about your lung health or somebody that you know. See you in 30 seconds.
I have asthma, and so asthma, I can't do that many sports because I wheeze and then I have to take my inhaler. I can't do a lot of things other kids can do. What I learned at asthma camp is how to treat your asthma and don't hold back if you have asthma. Breathe California has made it easier for me to play sports and do other things that I couldn't do before.
Welcome back to Breathe California TV. Well, that public service announcement couldn't be more timely because we're talking with Dr. Alan Goldsobel on the Breathe California board. Welcome.
Thank you very much, Terry.
So you had a reaction while we were watching it. What was your reaction to the PSA?
Oh, I thought it was very timely, as you said. In fact, our asthma camp is coming up in just a couple weeks, and I heard that we have 40 kids coming this year. So that'll be great. We're still seeing a lot of asthma in children and want to make it a fun week for them.
So I know I didn't brief you, we're going to talk about it, but it's just so well timed. Why would you need a separate asthma camp as opposed to putting healthy kids together with asthma kids?
Well, often, as you know, if you have asthma as a child or an adult, but particularly as a child, there often can be associated allergies that can cause a problem with outdoor camps around animals and in the trees and the grass. And also, most people with asthma have a component of exercise-induced asthma, and camp is a lot about running around. And so with the asthma camp, we just make sure that everybody's doing fine and are able to run, and if they need medicine, they can get it.
And they're in a similar situation rather than looking kind of odd or different.
Exactly. We're with other kids who have the similar problems.
So I want to congratulate Dr. Goldsobel and his board. About 10 years ago, Breathe California made a decision that asthma camp, treating asthma, helping people with breathing difficulties was important, and left a national organization, as did everybody in California, saying we still think people make a difference. We're not just going to be in New York raising money and doing advertisements to help people. So I want to congratulate you on that.
Well, thank you.
Okay.
You were involved in that as well.
Well, self-congratulation. I do plenty of that already. So we advertised that we're talking to you today as a follow-up. You laid out last time how the lungs work and function. Mm-hmm. I found it very informative, and I've been working on this stuff for 40 years. It does pay to talk to your doctor.
Yes, it does.
So first of all, maybe set the scene. Talk a little bit about the organization you work for here in San Jose.
Well, I'm, as I said, an allergist with a group called Allergy and Asthma Associates of Northern California, a group of 7 physicians and staff who take care of people with allergic diseases, respiratory diseases. See a lot of food allergy issues these days. And we have clinics around the South Bay.
And so we're going to talk about COPD and asthma and allergies and pneumonia, flu, tuberculosis. Any of those that you can't see patients?
No, okay. No. I mean, you know, we'll see the gamut. Not a lot of, luckily not, we don't see a lot of active tuberculosis patients. But no, we see a lot of those kind of patients.
Well, and that's great news. We were originally the Tuberculosis Society and then
Right,
thought we
exactly.
had that all controlled into the 50s and changed our name, but tuberculosis is still a problem?
It is. It is still a problem in certain populations, and often in people who've immigrated to California will develop tuberculosis. People who are at high risk for other diseases, particularly if they're HIV or immunosuppressed, often can secondarily get tuberculosis. So it's still something that's seen a lot, particularly like at Valley Medical Center and in the public health department.
So just one last note on TB, which reflects my own ignorance here. Is it bacterial? Is it virus? What is the source of tuberculosis?
It is an infectious agent, and it's Mycobacterium tuberculosis. So it's a mycobacterial agent, which is close to a bacterial agent. It's very infectious, and it's one of other types of mycobacterial agents that also are frequently causing people to have respiratory infections or lung infections as well. Tuberculosis is certainly the one that's the most well known, but maybe not the most prevalent anymore in the United States.
So we invented penicillin, which is supposed to control bacteria. Why in 1950 did we think TB was nothing, and now it's back? What's with that?
As you know, it's a biological fight, and these are evolving organisms, and they develop resistance to the treatments that the antibiotic or antibiotic-like treatments that we use in medicine. And so new drugs are needing to be invented for bacteria and mycobacterial agents, and they will use combinations of 2 or 3 drugs together to try to treat a certain infection.
So my impression is there's kind of, just to rephrase what you said, this battle between the bacteria that cause TB developing resistance and needing to develop a new version.
Absolutely, absolutely. And it's one big issue facing medicine going forward is to try to prevent the resistance of bacteria in general and mycobacterial tuberculosis infections in this particular instance.
So pretty significant stuff. Just last thing to ask you on this, although I said that 10 minutes ago. But I gather that sticking with a course of treatment, even though you're feeling well, is critical to preventing the formation of new bacteria. So talk about that.
It is. Tuberculosis in general is a very indolent infection that gets deep into the lungs and walls itself off and is not it's not easy to eradicate. And so it does take long courses of treatment, months to a year or longer of treatment. And you're not necessarily feeling badly, but if you stop before that time, the infection is incompletely treated and then can become active again.
Yeah, and not only you, but somebody else could
be at
pick it
risk.
up.
Absolutely.
So we started out talking about asthma camp. Is asthma a bigger problem for kids than it is for adults?
I mean, it's a bigger problem in that a higher percentage of children in this country and in the world have asthma, although total numbers, there's probably more adults with asthma than children. It often can be a problem in children in that their life is spent often running and playing, and often it can cause limitations, especially in younger children and in very young children, 2, 3, 4 years old. They have frequent episodes of wheezing and chest congestion from viral infections, which all young children get frequently. But in these kids, they'll end up in the emergency room, in the hospital sometimes, and that can be a big problem. Children are hospitalized for asthma more frequently than adults are.
So let me ask a second version of that question. Are kids' lungs more susceptible than a 25-year-old's lungs?
No, there's nothing that I'm aware of that says that their lungs are more susceptible. It's harder to use medication properly, and when you're young, and so it may be a little bit more difficult to treat it per se. But no, there's lots of very safe medicines that can be used for both young children, older children, and adults. When you get to be on the other end of the spectrum, 60, 70, 80, there may be aspects of the lungs and aging that would put them at more risk of having issues. But no, it's just asthma is a common condition in young children.
So you're saying at my age that I need to quit riding a bike 40 miles a day?
No, gosh,
If
no.
I'm exercising like a kid, isn't it making me more susceptible?
No. In fact, it is kind of an interesting dichotomy that in saying that in many people, it's estimated that if you have asthma, 80 to 90% of the people will have an exercise-induced component. But it doesn't mean that exercise is not good for you. And in fact, there are patients that I've seen in reports in the medical literature of people who exercise at very high levels, and that seems to be anti-asthmatic, and it improves their asthma condition greatly by exercising at a very high level.
So
keep it up.
True confessions, I walk 2.5 miles a day. But
Oh, that's good.
I'm not riding a bike. I was just trying to get an extreme example. But,
Right.
Overall, on people's health, then you want them riding a bike for 40 miles a day or some sort of cardiovascular activity?
Sure. Oh, absolutely. I mean, that has so many health benefits. Exercise on the heart, the lungs, your entire body. Everybody now is wearing these Fitbits, so you can see how many calories you burn just throughout the day. Any type of exercise, we need to get up out of these chairs and walk and move.
So the problem with Dr. Goldsobel is that he and I could talk for another 3 hours about all these disorders while I try to get a core dump on all of the information that he's learned in 40, 50 years of experience. We'll try to give you some good stuff in the remaining 14 minutes. See you in 30 seconds.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say 1 or 2 words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back to Breathe California TV. My name is Terry Trumbull, a volunteer with the organization. We're talking with Dr. Alan Goldsobel, a member of the board and a specialist in breathing difficulties. So just to emphasize, Breathe California has a phone number and a website, and if you want help or you want to volunteer, please come and join us. So a lot of different types of breathing difficulties, and it's hard to figure out which one to talk to. I've done a lot of shows on how smoking and air pollution cause problems, so let's talk more about the results. So you hear a lot about COPD because it's easier than spelling out a long acronym. What is it?
Well, COPD, as you alluded, stands for chronic obstructive pulmonary disease, and it's a disease involving predominantly the airways, the bronchial tubes, that become scarred and damaged over time from direct exposure to years of cigarette smoke and the toxic substances that come from burning organic material,
i.e. air pollution.
i.e. air pollution, right?
Yeah.
There are other things that can cause COPD pictures other than burning tobacco in certain industries and occupational exposures. Sure. But in the United States, most of the patients are former smokers, hopefully former smokers. And there you develop what's called an obstructive lung disease, which means that it's somewhat easier to get the air in and harder to get the air out. And so your lungs become overinflated and you can't get the air out, and you get this horrible sense of breathlessness. Often coughing can be part of it. Many of the patients will also develop a chronic bronchitis with a chronic wet cough, and it's a very uncomfortable condition where you are frequently breathless and even worse with any exertion.
So what you said sounds kind of odd. You can get air in, but it can't get out, so that you actually could have a lot of problems in essence because there's no more room to inhale air, i.e. get oxygen into your system.
Right, no, that's true. In fact, it's known that these patients with COPD do have hyperinflated lungs. They often, they can give you this false appearance of being very healthy men, say, who have very large chests, but it's not from muscles, it's from overinflated lungs that have literally pushed on the ribs for years, and so they look like they have these big, strong men, but it's just hyperinflated lungs that are too large, and they can't get the air out very easily.
So I shouldn't get COPD to impress my wife at how strong and bulky I am?
No, unfortunately.
Nobody would ever joke about it who had it, right?
Right.
So are there some really drastic solutions, like, I can't think of a better term than drilling into it to relieve that pressure? Are there people that have a breather or something to resolve COPD, or how do we handle it?
Well, most of the patients are treated with inhaled medications, somewhat similar to, or very similar to what is used in asthma. There are sometimes some more extreme cases where the lungs are taking up so much space that literally a surgeon will remove smaller sections of the lung to allow it to expand more, just to give more room, and literally by removing smaller
otherwise
sections.
It would impact the heart, which is nearby, or something
Right,
else.
right. It's getting so impacted in there, and so they literally will remove small sections of the lungs to make things better. It makes you breathe easier and feel easier. COPD is really important. It's really a systemic disease. It starts in the lungs, but it involves the heart. It involves all aspects of the body, and it's a horrible disease to have. And that's why Breathe California and other organizations are doing so much to try to continue to stop people from smoking.
Yeah, I mean, the medical system is all focused on treatment,
Right.
but at least this show we try pretty hard to prevent things.
Right.
So let me just go to one of those things that I, as a layperson, have heard. If I stop smoking and I haven't contracted any disease, am I better or worse off than if I'd never smoked at all?
You're definitely better off if you stop smoking, even if you haven't contracted the disease. Now, first is that you can objectively be measured on breathing tests or pulmonary function tests often that would show that you do have blockage of airflow and you may be asymptomatic. So just because you don't feel anything doesn't mean that there hasn't been damage to your lungs. But I like to say that everybody's lung function slowly diminishes over time. But if you're a smoker, the rate of decline is much steeper in going down. And what's been shown is when you stop smoking, the rate of decline doesn't continue on the steep curve, but takes the same normal curve that anybody else's lungs would be. So you lose the more rapid decline of lung function.
Well, you reminded me of something else, and we're not even going to get to all the questions you and I agreed to in advance because of that. So Breathe California's big fundraiser is a walk that's going to be at West Valley College at 10 a.m. on October 24th. At last year's, they were free lung tests that were being administered by the professional Breathe California staff.
Right.
And I took that, and the woman doing it says, you should see a doctor immediately. So talk about what's that's about, not so much me, but what are we testing when we do that?
Well, when we're doing those breathing tests, we're literally measuring how hard and fast the air is blown out of the lungs, and there's a little chip in each one of those machines that says, based on the individual's age and gender and height, how, if they're normal, if they're above normal, or if they're below normal. And I don't know what your numbers were, but there's obviously a wide range of what's normal. But if it is significantly below normal, it would suggest that the bronchial tubes are somehow constricted or damaged, that you're not able to blow the air out as hard or as fast.
Yeah, and I think the machine I got wasn't as sophisticated, because I did go see my doctor, and he pulled out the chart and showed that I was actually a little bit better than normal.
Oh, good.
You know, I tell you, I like to compliment myself on the show. I think the staffer thought I was a lot younger than I was.
That's probably what it was.
Because the drop off on the chart with age is pretty significant, particularly once you start clearing 60 or whatever
Right.
number you say.
Right.
So let's switch to areas that at least I confuse all the time: allergies and asthma.
Okay.
Are they the same thing, different? Describe what each is and what's the difference.
I mean, they're not the same thing, but they are closely associated, and in that meaning that they're very closely linked genetically. Allergies are reactions of your immune system, which is cells and organs in the body that fight off infection and fight off bad things that come into the body. But when the immune system incorrectly recognizes things that it shouldn't be concerned about, like pollen or dust or animal danders or mold spores or foods, and a certain part of the immune system starts to react against that, we would call that an allergic reaction. That reaction can occur on the skin, it can occur in the upper respiratory tract, it can occur in the lungs and the lower respiratory tract, or in the GI tract. And so those are the parts of the body that mainly manifest themselves in allergic diseases.
So just to be real overt about this, my brother was reported to have hay fever and basically was sniffling all the time. That's that
would be the allergic reaction that is predominantly localized to the nose and maybe the eyes. Asthma is a lung condition where the bronchial tubes, similar to what I was talking about with COPD, become inflamed and then constricted, and it's harder to get the air out. One of the main triggers of asthma is allergies, but it's also triggered by viral infections, by exercise, and by irritants and air pollution.
So maybe that'll explain something to me that I never got. When I was a junior in high school, I was captain of our basketball team, but I got a serious viral infection. And when I was feeling healthy, my lung capacity was zip. And then I got mononucleosis in my senior year, and the doctor said, don't do serious exercise for 6 months. And I'm going, huh? I feel fine. Right. So are either of those tied to what you were talking about with lung capacity, or is that just because my whole system was so weak?
Probably more related to your system being weak with the mono. Mono doesn't have a lot of involvement in the lungs. What happens with mono is your spleen, this one organ, in fact, I'm on the wrong side here. The spleen's on the left side. Your spleen gets very enlarged. And with exercise, the concern is that you could possibly rupture your spleen, and they wait till that comes back smaller. It was probably more that, and your whole system was, you know, kids with mono are tired and exhausted and don't feel like exercising.
So talk a little bit more about allergies. My sense is that during my lifetime, the amount of allergies has gone up, the amount of people with it. Is that true? And if so, is that some change in society that's being identified?
It does seem as if over the last 40 some odd years, 40 to 50 years, allergies and respiratory disease in general has been on the increase. And no one knows for sure 100%, but the leading theory is what's called the hygiene hypothesis, that we're born into too clean of an environment. And so the immune system is, and I'm talking about in newborn and babies, 1-year-old, the immune system is not being engaged to fight off bad infections. It's sitting there with kind of nothing else to do, and so it starts to react against these other things in the environment that it shouldn't really worry about. It's this clean environment, relatively clean environment. In places in Africa where they don't get vaccines, they don't get a lot of medical treatment, they don't have allergies or asthma.
So to end with 30 seconds on a more positive note, is there something we can do about preventing these issues? You got about 3 sentences to say yes or no and explain.
I think we will be able to prevent allergies in the future, but for right now, the best course is to just get treatment if you're having severe symptoms, see your doctor if you're having persistent, ongoing upper or lower respiratory tract symptoms.
So we've been talking with Dr. Alan Goldsobel. If you look at the questions that he and Christy Chow developed, the producer of this show, you'll see we hardly put a dent in them. So I'm going to try to get him back here in the next month or two or somewhere else on the show. See you next week.